If you are a woman trying to conceive, pay close attention to this video. Sometimes you guys said I talk too much, you don't watch my videos. This is teaching. I need to elaborate. There are some tests, there are some things you need to do to prepare yourself if you are trying to conceive, whether you believe it or not. Pregnancy is a process and must follow the due process. Before I dive into this video, I want to put a disclaimer. Myself, I am not a medical practitioner, I'm a researcher. I give general information that you can find everywhere. So my teaching shouldn't be used as a basic for any patient treatment. If you need help, prescription, recommendation, or further question, please always contact your gynecologist, your fertility doctor, or your healthcare provider. These are the people that have rights to prescribe something for you. Now, even the one that baffles me the most is this: a lot of women from the third world countries, when they are pregnant, they don't go for antenatal. They don't know how the baby that they are carrying is in their womb. That is why I said God is present in Africa. Now, you as a woman trying to conceive, regardless of your age, if I would beg you, please, my sisters, always go for medical checkup. These are the things that you need to do that will help you, that will facilitate. The reason why I say it will facilitate is this: if you go for example, preconceptional test. In this test, the doctor is going to check your uterus, which is very, very important to check if everything is okay. The doctor will check your cervix. A lot of women trying to conceive might have or develop incompetent cervix. And when you have incompetent cervix, you may be prone to miscarriages. A lot of women may have infection. A lot of women may have blocked fallopian tubes. A lot of women may have fibroid, especially submucosal or intramural fibroid, that either prevent them from becoming pregnant or leading to series of miscarriages. A lot of women might have low ovarian reserve, and you are trying, frustrating yourself, going into depression, crying, hoping, struggling to become pregnant every day. A lot might have hormonal disorder. But they don't know. Do you know that worst thing that can happen to anybody is that you are sick and you don't know the cause of your sick? In fact, you don't know what is stopping you. That is the worst, because you don't know where to start. Let's assume that you, as a trying to conceive mother, you go for hormonal profile test. And they find out that, oh, maybe your thyroid gland is not functioning properly. Simple. The gynecologist, the doctor, the fertility doctor, or the healthcare provider will prescribe hormone replacement medication, which you may take probably 3 to 6 months, and everything will be okay. When you have thyroid disorder, depending if it is hypothyroidism or hyperthyroidism, you will not be releasing egg, you will not be ovulating, and the absence of ovulation makes it difficult for you to become pregnant. The number 2, it prevents you is this from going into depression, because as you go early and your problem is identified, it will be fixed. So you don't need to be waiting, trying for years. You will hear women telling you, I've been trying since 5 years, 6 years. And when you ask them, what have you done? Which doctor have you visited? Which hospital? They will tell you, no, we are believing in God. So we'll be going to the church, praying. Don't be deceived. God answers prayer. God exists. But there are things you as a human being, myself as a human being, we need to do. God does the things of the spirit, and we human beings should do the physical one, which is you standing up from your chair right now as you are watching this video. If you haven't gone for any test, go. When you go there, always ask questions. If you have been diagnosed of anything, ask the doctor. Oh, for example, some people blame fibroid. Fibroid is a tumor that is not cancerous. Some fibroids are innocent. Some cysts are innocent. But when some of you have been diagnosed with fibroid, you begin to shiver. Oh, I can't get pregnant again. They say I have fibroid. Oh, what am I going to do? They wouldn't ask the person that diagnosed them. They wouldn't open their mouth to ask the doctor, but they will go online asking unprofessional, asking somebody like me who is a researcher, but you are in the presence of the doctor who diagnoses, whom you have every opportunity, access, right to ask, oh doctor, what kind of fibroid do I have? Where is this fibroid? Is it outside or inside? Is this fibroid going to prevent me from becoming pregnant? Oh, doctor, what should I do? You hear some of them coming here asking me, I have fibroid. What should I take? You can imagine. But you are with a medical practitioner, somebody that studied this, who can encourage you rightly. You wouldn't. So what am I trying to say? If you go to the hospital and the doctor diagnoses anything to you that you do not know more about, please open your mouth. You paid for that medical checkup, right? Open your mouth and ask, and don't be afraid. Don't be scared. Tell the doctor everything he needs to know about you. Anyone you want him to keep confidential, he will do it. But open, be sincere, be honest. If you have done a lot of things in the past, tell him. From your medical history, the doctor can preview what test you are to run. I don't know if I'm making sense. Some people will still come, you talk too much, go straight to the point, because I don't gossip. Make sure you undergo hormonal profile. Make sure you check your womb, your uterus, your womb, your cervix, infection, tubes. Make sure you check your egg quality by undergoing AMH test, that is anti-malarial hormone test. This test will enable the practitioners to know the amount or the quality of your eggs. Somebody said in my live program that she have they said that her AMH is high. What can she do to reduce it? I was asking her, do you know the meaning of AMH? She said yes. Because I know that if she know what it means, she will not be asking me what she can do to reduce it. People are looking for something to make their egg quality increase. You want to lower it, and you are trying to become pregnant. So if you are that person watching this video, it means that you have many eggs and you are in a better position to become pregnant. So you cannot lower it, and when it is low, you cannot hide it. So you should be thanking God and always visit your doctor. Make sure you take your prenatal vitamins. When you visit your gynecologist, they always prescribe this. I hope and believe that you find this video useful. Some people will still come and bash on me that I'm talking too much. Your data, no, they pay me. You are using data to watch free. You should be grateful. Always learn how to be grateful. Because if little is given to you, appreciate, then more will come. But if you don't appreciate, more will not come. Come on, guys. You guys should appreciate me. Thanks for watching.